Okay, V, it's been a minute. V is for vasoactive meds. And this is a confusing one. There is a difference between our primary vasoactive meds. And by these, I mean vasopressin, phenylephrine, norepinephrine, epi. Those are the four. There's a difference between them. And so when your doctor chooses one over the other or whatever, and you're like, well, I already had this one ready, there's a difference between them. And so let's just super briefly, bird's eye view, umbrella here. What's the difference between them? Let's start with norepinephrine. Norepinephrine does hit alpha 1 and beta 1, beta 2. It hits alpha 1 more heavily. So our biggest point of interest with norepinephrine is vasoconstriction. Alpha 1 is in the periphery, so it does cause potent vasoconstriction. Having said that, there is some beta 1 activity, and so it does cause vasoconstriction, but it does help the cardiac muscle a little bit. So there is some increase in cardiac output, there is some increase in chronotropy and inotropy, some increase in heart rate. It is pretty safe, doesn't cause a ton of arrhythmias, and so it's the one that we use in sepsis, the one we use in many different kinds of shock, because it doesn't cause a lot of arrhythmias, because it doesn't hit the cardiac muscle super hard. Epi, super broad, hits alpha 1, hits beta 2, beta 1 pretty equally, and because of that, it causes potent vasoconstriction, also causes pretty significant tachycardia, hits the cardiac muscle pretty hard, causes pretty significant tachycardia, pretty significant increase in cardiac output, pretty significant chronotropy and inotropy, and because of that, it's super arrhythmogenic. And so it's one, especially in adults, that we use for as short a time and for as low a dose as possible, because especially adults and especially older adults are very likely to slip into some kind of arrhythmia. Now, if we use it in ACLS, high doses in ACLS, and we achieve ROSC, we will likely use an epi drip in the short term, peri-arrest, right after we achieve ROSC, because it's the drug that brought the patient back. And so they typically need that kind of broad support right after their arrest event. But pretty quickly, we're going to switch over to norepinephrine because we don't want the arrhythmia, the fatal arrhythmia, to come back. Pediatrics is kind of an exception. Pediatric patients handle epinephrine much better than adult patients do without having that risk of arrhythmias. So that's the epinephrine story, and that's why we kind of use it a little bit shorter time as far as, and why we use it in a little bit lower doses than we use norepinephrine. Phenylephrine, sorry, that's why I haven't posted lately, been a little sick. Phenylephrine focuses exclusively on alpha 1, so no beta activity at all, no cardiac muscle stimulation at all, no increase in cardiac output. It simply causes vasoconstriction in the periphery. So it shrinks the vessels out in the periphery and raises blood pressure that way. So there's much less risk, if any, risk of arrhythmia. The trouble is, if you shrink those vessels and the heart isn't strong enough to beat on its own, like a heart failure patient or somebody with reduced ejection fraction for whatever reason, and you shrink those vessels and the heart's not strong enough to beat against those constricted vessels, it's not going to. And so you can have problems for that reason. And so because of that, we almost always use phenylephrine along with something else. So it's usually an adjunct agent along with epinephrine or along with norepinephrine. Similarly, vasopressin works on vasopressin receptors. And at least for the indication of shock, it is almost always used along with something else because it causes potent vasoconstriction, works only in the periphery, does not increase cardiac output at all. And because of that, we typically need to use it along with something else that will help the heart to pump against those constricted vessels. And so that is vasoactive meds: norepinephrine, epinephrine, phenylephrine, and vasopressin. V is for vasoactive meds. Farm ER.